Welcome to the cadaveric demonstrations conducted by the Department of Anatomy, Faculty of Medical Sciences, University of Sri Jalandhanapura. Today we are going to demonstrate the anatomy of the human heart. Externally, first we are going to discuss about the external features. Here, this area is the right ventricle, and here you can see the right atrium, and this is known as the right auricle. These two chambers lie anterior to the other two chambers. On left side, you can see the left ventricle here, and the left atrium is hidden posteriorly, and it lies at a higher and a posterior plane to the left ventricle. With the heart, some of the great vessels can also be seen here. I think you can identify the structures here. This is the ascending aorta, and this is the arch of the aorta, and this is the descending aorta. From the arch of the aorta, there are three vessels originating. Those are the brachiocephalic trunk, left common carotid artery, and the left subclavian artery. Here you can see the pulmonary trunk originating from the infundibulum of the right ventricle here, and it ascends, and when it reaches the concavity of the arch of the aorta here, it divides into two, which are your left pulmonary artery and the right pulmonary artery. You can see the left pulmonary artery here, which is cut, but you cannot see the right pulmonary artery, which is hidden behind the ascending aorta and the rest of the aortic arch. If we talk about the veins, you know this is the right atrium, as we said before. So this is the superior vena cava. It comes and it opens into the right atrium. Similarly, you should be able to see the inferior vena cava. If I turn this heart upside down, so I think you can see the inferior vena cava here. It opens into the inferior region of the right atrium. And here you can see the diaphragmatic surface of the heart. It rests over the central tendon of the diaphragm. The right ventricle lies opposite to the chest wall. When you look at the exterior of the heart, you can see number of grooves. These grooves lie between some ventricles and even between atria and ventricles. Here, this is your right ventricle and this is the left ventricle. In between these two, on anterior aspect, you can see a slight depression, which is known as the anterior interventricular groove, and you can see some vessel lying there. And in between atria and ventricles anteriorly, you see another groove which is known as atrioventricular groove. It lies somewhere here, but it is not very clear because it is filled by fat in the pericardium. If I turn the heart upside down again, you will see this atrioventricular groove extending towards the diaphragmatic surface of the heart. So posteriorly also it lies between two atria and the ventricles. So along this line you can see lots of fat is deposited in the groove, and some vessels are lying here too. And there's another groove over this surface, that is the posterior interventricular groove. So you can see your right ventricle here and the left ventricle here. In between these two there's a groove, that is the posterior interventricular groove, which is this one. And here also you can see some vessels. Here this is the apex of the heart. Further superiorly you can see a left atrial appendage, which is known as left auricle here. Externally you should be able to see the recurrent laryngeal nerve recurring around the concavity of the arch of the aorta here. Actually that is the place you get your ligamentum arteriosum. It is not very clear in this specimen. I think it has been cut off during the dissections. If you look further posteriorly, you can identify the trachea here. Here you can see the trachea can be identified very easily by identifying its cartilaginous plates. Further posteriorly, if I turn this specimen the other way, further posteriorly you will see the esophagus very clearly. And here you get the transverse sinus. So I am trying to insert my probe through the transverse sinus now. It lies between the arterial and venous channels of the heart. So this is the transverse sinus. You can see it clearly, I think. My probe has passed through the transverse sinus now.